Hi everybody, today's video is a very important topic for all rabbit owners to understand, and that is GI stasis. In this video, I will go over the signs and symptoms, treatment, our experience of the trip to the vet, recovery, and more.
Before we get started, I'd like to make it clear that I am not a vet. The content in this video is from my own personal experience of treating Blueberry during GI stasis, following the steps advised from our own vet. If your pet is ever in distress, the best advice and treatment will be from a rabbit-savvy vet near you.
GI stasis is a serious condition in rabbits that occurs when the normal movement of the gut slows down or stops completely. Rabbits ferment their food, making a lot of gas, and since they cannot burp or vomit, when the GI tract stops moving, it can be very dangerous and painful. If your rabbit stops eating or producing feces for 12 hours or more, you should consider the condition an emergency. Get your bunny to a rabbit-savvy vet immediately. GI stasis is known as the silent killer. Rabbits are prey animals and have a master ability to hide their illness. Often by the time they start showing symptoms, they are already quite sick. This is not a tummy ache that will go away on its own. The sooner you act and begin treatment, the better chances your rabbit has of a recovery. If left untreated, it can lead to severe complications and even death. The best thing you can do as a rabbit owner is understand the signs and symptoms and how to help them. Rabbits are very food motivated, so if your rabbit is not eating and refusing their favorite treats, this is the #1 sign that they are not feeling well. Breathing fast is a symptom that your bunny is in pain. When a rabbit is in pain, they may hide and want to be alone. If I notice Blueberry doesn't come running out to me, this is normally a sign she isn't feeling herself. Blueberry hides in her litter box during GI stasis. She goes there to be alone and sits there struggling to poop. Another symptom is that you may notice your rabbit pushing their tummy to the ground. This is a sign of stomach discomfort. Smaller poops, or no poops at all, mean that your rabbit's digestive system has slowed down or stopped. In this photo to the left are her poops during GI stasis compared to her regular poops on the right. A rabbit's intestine can become static for a variety of reasons. Rabbits are extremely sensitive, and stress can cause GI stasis. Some examples are car rides, new visitors or a pet in your home, construction, fireworks, or a big change in their environment. Another cause of GI stasis could be dehydration. It's important to ensure your rabbit is staying hydrated, which helps with the overall gut function. Some rabbits get GI upset when they are eating too many carbohydrates, like pellets, treats, carrots, and sugary fruits, and not enough high-fiber Timothy hay. This is very important to have in your rabbit's diet. Blueberry struggles with stasis during molting periods when she is shedding a lot and ingesting too much fur. Monitor any changes in your bunny's poop. This string of pearls poop is a heads up that your rabbit needs more regular grooming, or they may be at risk for a gut slowdown. It's important to brush your rabbit every day. Most of the time, GI stasis is a symptom of an underlying disorder causing your bunny enough pain to cause the GI tract to slow down or stop. Some examples could be dental problems like an overgrown molar or abscessed tooth, or infections like an ear infection or urinary tract disorder. A trip to your rabbit-savvy vet can help diagnose the root cause of the stasis episode. For example, earlier this year, Blueberry had a couple stasis episodes. After a vet visit and culture swab of her ear, she was diagnosed with an ear infection. After we treated the ear infection, the stasis episode stopped and she was feeling much better. As soon as you notice the early stages of GI stasis, you need to act. It is always best if you can go right away to a rabbit-savvy vet, but there has been many times where Blueberry is in stasis and our vet is closed, so I begin treatment at home following my vet's advice. The first thing I do is give her baby gas drops. Simethicone helps to break down any gas bubbles that could be forming during a gut slowdown. Give 1 to 2 milliliters every hour for 3 doses, then 1 milliliter every 3 to 8 hours. Simethicone is safe to give, even as a precaution. Blueberry is actually quite fond of baby gas drops, and sometimes if I notice her eating habits are a bit off or she seems uncomfortable in the very early stages of GI stasis, I will offer her some and she licks them right off the syringe. Pain relief can be the key to keep a bunny fighting to live through the extreme abdominal pain during GI stasis. Since Blueberry seems prone to GI stasis, we keep Metacam, a pain relief drug, on hand in case of emergencies. During GI stasis, hydration and pain relief are critical till they can be seen by a medical professional. If Blueberry is not eating, I force feed her Oxbow Critical Care, which is an effective emergency food formulated specifically for pets that are unwilling to eat on their own. Its number one ingredient is high-fiber Timothy hay and provides both liquid and fiber to help stimulate digestion and keeps their gut moving when your rabbit is experiencing GI stasis. Mix the critical care with water till it becomes a paste. Carefully and slowly feed it to your rabbit through the sides of their front teeth. Give 1 to 2 milliliters at a time, allowing them to chew and swallow, as aspiration can be life-threatening. Please note, never force feed your rabbit if you suspect a blockage. Before I syringe feed Blueberry, I check to see if her tummy is doughy and if she is pooping. If your rabbit's tummy is hard and balloon-like and there's been no poops for a few hours, this could be bloat, and force feeding could make the situation worse. If you are unsure on how to treat your pet, remember, a professional rabbit-savvy vet is always the best choice. After critical care, I also provide a few syringes of warm water to ensure she is staying hydrated.
Gentle tummy massages can help to stimulate a lazy gut and relieve gas pain. Simply move their tummy back and forth from side to side. Sometimes you may even hear gas being relieved when massaging their tummies.
A rabbit's temperature in stasis can drop quickly, so it's important to keep them warm. I put her on a heating pad, which can also help with tummy pain. Here you can see her ears are pulled back and her eyes are squinty, which are 2 other signs that she is in pain. Monitor their temperature carefully with a rectal thermometer. However, this can be quite difficult to do on your own, so another good indication is to feel their ears for temperature. I continue with these steps until she is eating and pooping on her own. If there is no progress with at-home treatment after a few hours or her symptoms become worse, then I take her to a rabbit-savvy vet. A vet will be able to assess the severity of the condition, provide appropriate treatment options, and give advice on how to manage and prevent future stasis episodes. When Blueberry was admitted to the emergency vet, they gave her subcutaneous fluids to help hydrate her. If your rabbit's temperature is low, they will put them inside of an incubator to raise their temperature. Depending on their symptoms, they may also rule out a blockage with an X-ray. They may also run a blood test to check for any underlying conditions. They will be provided with pain medications and possibly also motility medications and/or appetite stimulants to enhance movement of food through the stomach and intestines. Blueberry has had stasis episodes that only lasted a couple hours and some that were very serious and required an overnight stay at the vet. It can be so stressful to know they are at the emergency vet, but try to remember they are in the best hands there. If your rabbit was given sub-Q fluids at the vet, do not be alarmed if you notice a pocket of fluid that has formed. It will be absorbed slowly over several hours and ensure your bunny is hydrated. I continue with critical care feedings till she is eating and pooping on her own for over 24 hours. When she is not feeling good, she does not like the syringe feedings, so it's always a great sign when she's willing to lick the critical care off the plate all on her own. If any pain medicine or intestinal motility drugs were given, follow your vet's prescription. When your bunny starts pooping again, the first batch may be small and misshapen. This is to be expected as the GI tract restarts. Consistent, gentle nursing and reduction of stress are essential at this time for your bunny to make a full recovery. The most effective way to manage GI stasis is through prevention. Ensure your rabbit receives plenty of fiber from fresh hay and high-fiber pellets. It's also important that your rabbit drinks enough water to keep food properly hydrated and moving through the digestive system. Routine checkups with a rabbit-savvy vet can help identify potential health issues before they become serious, which could lead to GI stasis. By offering a balanced diet, encouraging regular exercise, and seeking prompt veterinary care, you can maintain your rabbit's gastrointestinal health and prevent stasis-related complications. We hope this video has helped you to recognize the signs and symptoms of GI stasis and provided useful tips on prevention and treatment. We also hope it helps to assist in saving many bunnies' lives in the future who show early signs of GI stasis, while we remember those who have unfortunately lost their battle. Thank you for watching.